Almost two-thirds of adults in Britain, in present company included, are overweight. That's around 35 million people.
Yesterday, the government minister, Therese Coffey, told us that the UK's obesity crisis contributes to why we have one of the world's worst coronavirus death rates.
It was the first time we've heard any of the government really go on record citing a specific reason for why we have one of the worst coronavirus records in the world. So are Britons to blame for being too fat? Well, joining us now is cardiologist and Professor Dr. Aseem Malhotra and Olympic swimming legend Sharron Davies, and of course Dr. Hillary is here. Start with you, Dr. Hillary. Are we too fat, and has that been a contributory factor to our COVID record in terms of deaths?
Yes, 62% of the British population are overweight and 25% thereabouts are obese with a BMI of over 30. Obesity causes a number of things. We know about type 2 diabetes, heart disease, strokes and cancers, breast cancer and bowel cancer particularly, all associated with obesity and a greater risk there. But obesity causes an inflammation, general inflammation within the body, and that's a major factor with COVID-19. If you're unfortunate enough to be contracting COVID-19 and you're overweight, your risk is much greater of serious infection.
Dr. Aseem Malhotra, back in April, Boris Johnson emerged from hospital having recovered from COVID and did a press conference in which he was very honest and said specifically that he had an underlying condition that contributed. Let's have a look.
I have to admit, the reason I had such a nasty experience with the disease is that although I was superficially in the pink of health when I caught it, I had a very common underlying condition. My friends, I was too fat. And I've since lost 26 pounds, and you can imagine that in bags of sugar. And I'm going to continue that diet because you've got to search for the hero inside yourself in the hope that that individual is considerably slimmer.
Since then, Dr. Malhotra, we haven't heard very much about sort of tackling the issue of obesity. I wonder whether that's because it's quite a sensitive issue when it's a contributing factor to the severity of the disease of people who are suffering.
Good morning, Susanna. Absolutely. I think there's a number of factors involved here. First of all, what I'd like to say is that no one chooses to be fat. No one actually chooses to be overweight. An OECD international poll reveals that what matters most to people in life is their health, followed by a happy family environment. So the question is, what is going on in the population? And the reason we've got to this stage, Susanna, is because we've not really tackled the root cause. Now, almost 10 years ago, the Academy of Medical Royal Colleges, which represents most of the doctors in this country, and I was involved in their report, looked at what needed to be done to tackle obesity, what was at the root of it all. And the real root cause is the food environment. We have really got an oversupply of ultra-processed junk food. Wherever you go, it becomes unavoidable, Susanna. Even our hospitals, sadly, have become a branding opportunity for the junk food industry. 75% of food purchased in hospitals for staff, for patients, for members of the public visiting is unhealthy. So we've normalized these sorts of foods, and now 50% of the British diet, unfortunately, is coming from these sorts of foods.
So
now,
your
the
criticism,
question is,
so your criticism, Dr. Malhotra, is an interesting one, because when Therese Coffey said obesity is part of the problem, you're saying, well, that's a government responsibility, that the government should crack down on the food industry, because frankly, we're all eating too much junk. Sharron Davies, I know that you have a different view, haven't you? When Dr. Aseem Malhotra says no one chooses to be fat, you insist it is an individual responsibility.
Absolutely. It's a bit of both, isn't it? If we were really honest, you know, all these things are complex. They're not straightforward and very, very simple. Otherwise, we would fix them very easily. There is too much cheap, high-calorie food available. We eat too much processed food. Processed food is full of sugar. That's somewhere we could reduce straight away. However, when you walk past a fast food joint on the high street, nobody rushes out and sticks a burger in your face. I mean, you actually do go in and buy it. And when you actually go to the supermarket, you know, if you put donuts in your shopping cart instead of apples, then that's your choice as well. And we have done a lot with food labelling. We try to educate our children. I was doing food tech with my son yesterday. I don't believe that if you told children, you know, if you asked a child what's the most healthy between a donut and an apple, they wouldn't know what it was. So it is about the choices that we're making. We're also living a much more sedentary lifestyle. So, you know, unlike Piers, who's getting on his Peloton, which is fantastic. Not everyone is doing that. And we need to increase our physical activity.
Well, that's
and
partly enforced
really
upon
important.
us right now, isn't
I
it?
feel like I have to, otherwise it really would be Gerard Depardieu time. And I think the thing, Dr. Hillary, I call it the giant Toblerone bar test. When we go to an airport in our country and you go into Smith's and you buy a paper or a drink or whatever, and you walk up to the counter, for
Do you want a £1 chocolate bar with that?
inexplicable reason, there are always gigantic, oversized Toblerone bars. And they're all at a shockingly cheap price. And I'm like, who buys these things? They're literally like this. And I think that's the test.
Who can resist these things?
Yeah, they're tantalising and they're trying to suck you in to, help kill you, basically, by making you eat giant Toblerone bars.
Yeah.
But I call that the self-discipline test. I walk away from the giant Toblerone bar.
Do you?
Nobody's thrusting these chocolate bars down our throats. We choose to buy them. We choose to eat the kind of foods that we eat. We choose to eat the quantity of food that we eat. So we might not choose to be fat, but the consequence of choosing those foods and not exercising sufficiently is that we become overweight.
OK.
And that's an unmistakable truth. But the government could be doing far more.
Yeah.
Why are we advertising huge confectionery bars?
Yeah.
Why do we put temptation in front of people?
But that's my point,
Why
Hillary.
do we allow so many fast
That's my
food
point. We
restaurants
should
to open up in the high streets and not subsidise healthier
But that's
food?
my point, is this constant subliminal sell on all this
the time.
stuff. And yes, I totally agree with Sharon. It is about self-discipline, and I've got to exercise as much as anybody else, literally. But it is difficult in our country because you are constantly exposed. America's the same.
Yeah.
They have a similar problem.
Dr. Malhotra, Dr. Hillary had mentioned that inflammation is one of the significant factors, but just outline for us the reasons, the full list of reasons why obesity and overweight contribute to sometimes a worse effect of COVID in an individual.
Yeah, Susanna, so I think there's a few points I'd raise there. One is actually the situation is much worse than just obesity. So it's estimated 80% of the population in this country are over fat. They have excess body fat that's going to put them at risk of health problems and increase their risk of COVID-19 mortality. So basically that means it's not just people who are overweight or obese. About 40% of people, especially if you're from a Black or South Asian background, have excess body fat that's going to put them at risk of these conditions, which are actually associated with much increased risk of death from COVID-19, greater than obesity. We know vitamin D deficiency is a big problem. Studies have shown there's a 10-fold increased risk in death rates from vitamin D deficiency from COVID-19. And the majority of South Asians and Black people in this country are either deficient or severely deficient. This hasn't been adequately addressed. About 50% of the population who are from not ethnic minority backgrounds as well. I think what you've raised about the immune system, one other thing that's very clear now is high blood glucose, even in people who are non-diabetic, has now been associated with increased death from COVID-19. So the reason I'm saying that, imagine you're in a situation, if you're unfortunate enough to contract COVID-19, what you eat at that time could be the difference between life and death for you. If you're eating junk food or high sugary foods, that's one thing. Another thing just to mention, it's really important. Sharron Davies talked about physical activity. I'm a huge advocate of exercise, certainly for cardiovascular disease. There are many benefits of doing regular activity, and only 60% of people in this country are meeting the physical activity guidelines of 30 minutes at least 5 times a week.
It comes
but
down
when it comes to weight,
Yeah.
when it comes to weight, physical activity has absolutely no effect on weight whatsoever.
It's a
mixture, isn't it? Look, it's a mixture of...
exercise does nothing for weight loss.
Well,
Nothing.
no, I think exercise gets you fit, but you have to lose weight. You got to watch your diet and what you put in your gullet.
Absolutely.
Let's be honest. Just watch what you put in your gullet. Ignore the giant Toblerone.